So we're going to look at palpation for the elbow assessment. And to start, we're going to keep changing position just for the purposes of the camera. But obviously when you're doing the assessment yourself, you'll try and keep the patient in the same position. Okay, but for the purposes of the camera, I'm going to move Kevin round so we can see. Firstly, what we're going to look at is the medial and lateral epicondyles. So I'm going to put Kevin into the anatomical position. It's easiest to do. Then I'm going to come on the inside. If I work my way with my fingers down the humerus and just on the inside, you then come to the bump, which is his medial epicondyle. Okay, feel around the medial epicondyle. Okay, and so I can feel that there. Coming down the other side, if I use my thumb, I can come down the outside of the elbow and eventually come to the lateral epicondyle, which is the first bony point that I find working my way distally down the humerus, and I can feel all the way round the lateral epicondyle there. Okay? We're then going to move on to the head of the radius. So I'm going to just get Kevin just to turn around for the purposes of the camera so you can see. I always try and find this in the extended position first. So as you come down, you'll get to the lateral epicondyle there, and then there's a dip just underneath the lateral epicondyle, and then underneath there, more distal to that, is the head of the radius. I can check that now if I go into flexion and just passively supinate and pronate Kevin's forearm, I can feel the head of radius moving underneath my thumb. At this point now we'll now move on to the electron, part of the ulna, and you can feel this here as we work all the way around the electron, and just feel that there. Okay, and then we're now going to move along to turn around again, talking about the joint line. So the joint line, when the arm is in an anatomical position and extension, it's usually where the elbow crease is. So it goes just distal to the two epicondyles, which I can feel here. So just distal from between my fingers. And as you can see, it's at an angle. It's not straight across, and the carrying angle, which takes the forearm out to the side. So as you can see there, my two fingers, the angle that makes the joint, and that's where the joint line of the elbow is. Okay, we're then going to move along to the radius. So as we palpate from the head of the radius here, working all that, it disappears underneath some muscle, and we work all the way down to the distal end of the radius, feeling all the way down until we get to the radial styloid at the bottom. Okay, so that circles around the bottom, just proximal to the wrist joint, and then work back up again the radius. Again, as I said, it disappears underneath the forearm muscle here until you get to the head of the radius again. In terms of the ulna, if I get into an anatomical position, I'm going to work my way down from the electron there, and I can feel the ulna, and then again it disappears underneath the muscle. If I get Kevin to turn round for me, so from the electron, it starts to disappear, okay, underneath the muscles here. It then reappears again halfway down the forearm, and go all the way down to just proximal to the wrist joint, and that's the end of the ulnar bone there. Okay, and then finally we're going to show the collateral ligament. So again, if I can get you to turn around for us. In an anatomical position is the easiest thing. If I come down and get to the medial epicondyle of the elbow, and then the anterior band of the medial collateral ligament goes from the medial epicondyle down towards the coronoid process on the ulna. The posterior band goes from the medial epicondyle back towards the electron, and the transverse band goes from the coronoid process around to the electron. So it's a triangle shaped, the medial collateral ligament of the elbow. On the lateral side, it goes from the lateral epicondyle to the head of the radius and to the annular ligament that wraps around the head of the radius. And that can be felt in that gap between the medial epicondyle and the head of the radius. And that's the lateral collateral ligament. That completes the palpation of the elbow.